Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Shiv Goel, internal medicine physician. Today's Kevin MD article is Claude for Healthcare versus Administrative Burden, a physician's review. Shiv, welcome back to the show.
Thank you. Thank you for having me, Kevin.
All right, so today we're going to talk about Claude for Healthcare. It's the new product from Anthropic, which is one of the large language models. I know ChatGPT also has ChatGPT Health, so they are going into the healthcare space. Tell us, for some context, for those who aren't familiar, what Claude for Healthcare is and why you decided to write this review on Kevin MD.
So the Claude for Healthcare is it's a large language model which is developed by Anthropic that's being adopted for the healthcare tasks like summarizing the chart, helping draft documentations, and supporting insurance like revenue cycle workflows such as prior authorizations and appeals. So in Claude for Healthcare versus Administrative Burden, my article, a physician review, I walk through how this tool performs when pointed directly at the real bottleneck physicians face: eligibility check, prior auth narratives, appeal letters, and clerical chart work, rather than abstract AI demos. So for example, take common high friction admin task from our internal medicine practice and how Claude generally saves time and cognitive load and where it risks adding steps or errors. So like a scenario in which a Claude drafts strong payer-friendly justifications in seconds, but also warn that if health systems simply treat this as a free labor, they may use it to stack more visits or tasks onto already overextended clinicians and overburdened clinicians and doctors.
So how does it work? So for those who aren't familiar and didn't watch the demos, you mentioned that example with prior authorization. Tell us about the step-by-step approach about how it worked.
So the model as such, which they have developed, they haven't launched it yet, but they have like announced it that what we need to do, like before, it used to take hours and hours on the phone with the people with the insurance company to get a prior authorization, whether it's for a procedure or for medications or something. You keep faxing them detail. So now you just the cloud, you have all the informations on the cloud. It's like you submit it to that, and they are the ones who take care of in the background. And if they need anything, they automatically create everything into it and send it to the insurance companies because they have been the AI, the large language model has been trained in how exactly each insurance company wants, because every insurance company have their own criterias, like how they want it, and it keeps changing every time. So they have every possible outcomes in their mind. And so instead of us being taking so long and we don't have to be on the phone, the AI, it does it in the background, and they have a collaborations with every insurance company, and now a lot of them are using AI assistant. So as long as it meets their criteria and the clinicians when they are submitting the documents, it creates in second then.
So Claude would have access to the patient's chart, or you would have to upload the patient's chart to Claude. And in the background, it will take whatever's relevant from that patient's chart to
Exactly.
process the pre-authorization. It could be for an imaging study or a drug, automatically send it in the background to the insurance company. Is that, have I got it
Yes.
right?
Yes. Exactly. Thank
So
you.
do they have any success rates in the demo or the pilot projects that shows how much more successful an AI prior authorization tool would give a clinician?
Right now, I haven't personally used because they just launched it, but it looks very promising. And that if it can done, because I think there are few or the HIPAA laws and regulations they have to go. But if it does, because it seems like a easy process to get it done, as long as we are mitigating it through the right tools.
Yeah.
And my thing was for writing the article is not that if AI is making our life easy, it definitely is. Or if it is going to replace physicians or not, I don't think it can replace physicians, but it is about after we implement all those things, and our administrative burden is so less, which so that doctors should work as doctors.
Yeah.
Physicians mind is more valuable instead of just working as a doing an admin stuff. Would that cause more workload on physicians? Would the hospital systems or the all the big bureaucrats, they would want you to see more and more patients because they think now you have more time,
Yeah.
or they would have you do other work. So that is something which I wanted to prioritize, that are we really thinking about that it is making our life easy, or is it making our life more tough?
And I think that this topic has come up in the past, especially with those ambient AI scribes, right? They've shown to decrease the cognitive burden, and physicians are already so burnt out. But when it
Exactly.
comes to these administrators, they only see the numbers. They see physicians spending less time in the chart and maybe less cognitive burden, and they're going to think, oh, why don't we just load up on more patients, right? So it is important, and I would say imperative for healthcare administrators not just to look at the numbers and realize that their physician workforce is already burnt out, and the answer for this increased productivity gains that AI gives them isn't simply to load them with more patients.
Yes, exactly. And I think this impact, it will depends also on the governance, the workflow design, how it is, or whether physician really has a voice in implementation. Because it feels like every tech company, whether it is Claude or it's ChatGPT, they are creating something, tools for the healthcare, for the physicians without their say in the system.
Hmm.
Because the main reason why physicians were burning out, because of so much of documentations, admin work, seeing 20, 30 patients on top of that in order to make their livings. And now, if AI is there to take away the administrative burden, they should have more time to talk to the patients, to
Hmm.
really help in the healthcare, because a lot of time we hardly could spend 5 minutes with the patients, because on the background before and after we are spending almost 30 to 40 minutes just on the administrative task for that
Hmm.
patient. So that time, instead of increasing more load, which doesn't lead to anywhere, because even the patient outcomes, I have seen, I've worked in the inpatient setting for a long time, around 15 plus years, and work in the outpatient settings for almost 6 years now, and work as a in a university academic setting as well. And I have seen it everywhere. It is the same thing. We are doing just a band-aid approach to the healthcare system, most likely a triage system. Patient comes with the symptoms, uncontrolled diabetes, we give them extra insulin, increase the dose of this, but we never have a time to
Hmm.
really address the issue why their diabetes is being uncontrolled, why they have diabetes to begin with. Is there something we can do? And then we refer to the primary care physician, and the primary care physicians, we think they're going to take care of the preventive disease, but they are also overburdened. They have hired 2, 3, 4 nurse practitioners to take care of those patients, those who basically just keep refilling the same script again and again.
Hmm.
So the main thing is that how can we navigate this? Why not physicians have a voice in creating the systems which are for them,
Hmm.
instead of creating things which is just imposed on you? We should be voicing in creating it, number one. Number two is that to revolutionize the healthcare system, so we focus on the root cause issues of the problem, so patients can really get benefit, which can really result in decrease hospital admission rate, ER rates, decrease morbidity and mortality. Because if we can spend those, instead, if the AI can save us 40 minutes for a patient, out of that 40 minutes, even if we spend 20 minutes
Hmm.
with the patient, finding out what's causing us, the issue, educating the patients, giving them the handouts. AI can help us giving a lot of educational handout. We can give it to them. We can not just save 20 minutes for our own life also, but also will improve the healthcare system in general. People will benefit, and we will not feel overburdened and burnout.
We have to be careful that we don't let what happened to us in the EMR, electronic medical records. Physicians didn't have a say, and you have all these systems just imposed on us that didn't really take into account clinical workflow. And I agree with you
Exactly.
that physicians need to be involved, especially with this AI boom. So how can we physicians do that? How can physicians get involved with all these new AI tools?
I think this is where we all have to be united and voice about it, because even if I have seen that there are so many companies which are so-called consulting the physicians for this, consulting a physician, and it's not about consulting a physician who is just being in the studio or advertising their own supplement
Hmm.
company. The people, those who are really in the field, they have the clinicians who are working day and night, those who understand the problem which is happening, and it should be go side by side. So, and those tech companies not going to come to us.
Hmm.
They are not coming to us that, hey, what's your thing? And we want to create. We have to voice it, so that until unless we all stand up and voice it, it is not going to change. Or otherwise, we can just sit and have something come to us and direct us what to do.
Is there anything that worries you about this increasing reliance on large language models like Claude for healthcare? For instance, hallucinations, misinformation, or even these insurance companies, I'm sure they're using their own AI tools as well. And you're just going to have a fight between AI models in the background.
Yes, actually, so what has been happening is that AI should be only used as a tool to provide a possible outcomes, not for making the diagnosis,
Mm.
not for saying that this is what it is. Like, I recently saw the Trump administration has launched AI agents,
Hmm.
which, as per them, in 6 months, they're going to get an FDA approval, and in 3 years would be for cardiovascular diseases. They they are the ones who just like, they are not consulting, they are telling what to do. Okay. And that's where lies the real problem. We have seen recently so many cases. There was a teenager who killed himself because, and asked the AI how to kill himself.
Mm.
Okay. Because he got so much in love with that AI, which had felt heartbroken. And and there's so many other cases which has been happening. AI is not a human. AI is basically collecting all the data and providing it to you. We need to, which is a good tool. It can make your work, like administrative work or a reading work, or creating the notes, script work, so many things easy for you.
Hmm.
We need to use it as a helper. AI cannot replace it. There is no way AI, people have this fear inside them. The more fear they have, definitely it's going to replace the ones who has the fear. It cannot, and this should not be, we shouldn't even let this happen, because AI is not there. AI is not a human. It can't read the emotional healing, emotional part of the patient, because a lot of time it happens when a patient walk into the room, or I walk into a patient room, it is not just what the patient is saying, it is what the whole picture is telling me. Those, the space in between, the silence, the patient emotional resonance, and that gives me more idea about what might be the real problem is.
We're
If
going
a
to
patient says that, yes, oh, yes, no, I'm okay. But if the whole response of this, I'm okay, like it's like I'm not really okay, but I'm saying I'm okay. So there's a lot of things which we have to consider. And plus, it is not always about symptoms.
hmm
It's more about how we take, because a physician who has spent like I've spent 20 plus years seeing thousands and thousands of patients from different cultural background, different ethnicity, different take on their life, their belief system, how and why they do things, why this thing affect them, why this thing doesn't affect them. And same problem, like same symptoms in 10 different people will have 10 different diagnoses. And that is where lie that your clinician judgment to
hmm
see what exactly I should be doing. Should I be prescribing this patient? And those large language models, they shouldn't be touched by technology company all the time, because if they change the whole system. So that's the point. If we create AI as agents to implement things, that means we are telling the doctors, because if we don't voice, then those AI agents will be telling us what to do.
hmm
Because if the doctors feel that we are too busy for our work to make our living, then we will be working under an AI. And at the end, who will be suffering? The patients.
Mm-hmm.
People are the one who are going to suffer because it's a revolution which is happening, and the race is not between two AIs. The race is between who will be the next AI god and who will control, because healthcare is everything. Because health is related to your mind, body, and even spiritual health, your social health, your emotional health. And if we take up mental health, even the psychiatry, now it's going into the mental health as well.
Mm-hmm.
So while at the same time, people feel excited, like I felt so excited that day when I had to spend so many hours getting this authorization, and I heard this, it can get it done in seconds. But then it also made me feel that, but wait a second, what's going to happen then?
Yeah. We're talking to Shiv Goel, internal medicine physician. Today's Kevin MD article is Claude for Healthcare versus Administrative Burden, a Physician's Review. Shiv, let's end with some take-home messages they want to leave with the Kevin MD audience.
Yes, so AI like Claude for healthcare, it will not fix the medicine by itself, but it can be a powerful tool if physicians stay at the center of how it is designed and deployed. The goal isn't to make us faster typists.
Mm-hmm.
It is to remove the administrative noise that keeps us from thinking, listening, and connecting with patients. If we pair these tools with a thoughtful leadership and strong boundaries, we can claim time, reduce burnout, and build care system that serve both patients and clinicians far better than what we are living with now. But we have to stand up and voice. Otherwise, the same system which is designed for us will be designing us.
Shiv, as always, thank you so
Thank
much
you.
for sharing your perspective and insight. Thanks again for coming back on the show.
Thank you for having me, Kevin. Always.